Hey guys, happy 2002, welcome back to my channel. Sorry for the super delay for the most essential Chinchilla Dental Disease episode. I have been pretty super busy with new Piggy's family members, plus I was sick a couple times before and after the New Year's. I'm still not getting well yet, but it's getting much better, and I don't want to keep you guys waiting. So here we go. To follow up on the last episode, today we will learn about the cause of the chinchilla's dental disease. Like chinchilla trees, there's many different opinions regarding chinchilla's dental disease, or what most people call monocultions. But opinions are one thing, facts are facts. Today in this video is trying to help you to understand the cause of this horrible disease scientifically. There's many discussions about diets and genetics as the cause of the malocclusions. Some people are often very subjective to believe either or. However, scientific studies tell us that chinchilla dental disease is caused by a few significant factors. Instead of arguing about whether it's diets or genetics, I think we should put it into two different categories: intentional and unintentional human factors. Through my last few years investigating dental disease, I realized many people do not take this dental disease seriously. The worst thing is the uneducated or bad breeders using a cheap things as a shield to breed sex animals. They can't explain why the chinchillas have a teeth problem or intentionally breed genetics issue chinchillas. They often use the terms and cheap things, or all rodents will get teeth problem when old, or just like dogs have a hips problem or cats have kidneys problem, etc. To dodge the briar give us a false impression that monocultion is unnatural for the chinchillas. Still, the truth is this horrible disease mostly can be avoided. And how to avoid it? We will talk about it in next Monocultion Part 4b. In 2001, Dr. Crossley did the most extensive study about chinchilla dental disease. 651 assumed healthy chinchillas were examined. These 651 chinchillas with no apparent symptoms. However, the result was quite scary. It showed 35% dental abnormalities, overgrown incisors in 31%. Palpable molars in the lower jaw in 39%, abnormal molars in 28%. On X-ray examination, they found more long front teeth molar growing down into the jawbone or up towards to the eye sockets and the nasals, respectively in total of 69%. Studies tell us the chinchilla's dental problem has been studied and many scientific facts, but it's not that easy to find out due to its nature as we mentioned in the last videos. Unlike many bad breeders who tell you not sure why can be this or can be that, these are signs that tell you those breeders do not take the dental disease seriously, because a responsible breeder should know the herd inside out. It is caused by environmental or genetics problems. First, we look at the medical definition and classification of monocultions. It basically means that when the teeth are misaligned, which is not typical to adjacent teeth in the same jaw, and or the opposite teeth when the jaws are closed. I want to clarify that not all the dental problem belongs to monocultions. In Dr. Crossley's study, mono has a range of signs to indicate a specific conditions. Also, Kennedy's study point out that commonly known as slobber, which is often indicated oral disease but not necessarily monocultions. We shouldn't really just call all the teeth problem as a mono. We should carefully identify which dental problem when it comes to monocultions. Since there are different reasons for the cause of the dental problem, such as accident, injuries, or diet problem, I would prefer to call it a dental problem. For the most problematic genetic issues, I would call it a mono. I want to distinguish between the two mainly to prevent some people keep using a chin things or all rodent is normal to get models as an excuse to cover up they were breeding sick animals. So to make it easier and simple to understand, I put a few different factors. Number one, environmental factor, such as a bad diet, tumor to the jaw. Number two, inherited issues such as teeth disorders or bad genetics. Number three, breeding issues such as pelvic dysfunctions or hormone stress. Chinchilla has open grooves that all teeth grow continuously to grow throughout life. Their upper incisors grow at approximately 6 cm and lower incisors at about 8 cm per year. Chick teeth 12 to 14 mm per year, around 0.14 mm per day. In a natural situations, the molar teeth wears about 1 mm every week. The incisors wears about 3 times as fast. One thing worth mentioning is that the study wild chinchillas and the captive chinchillas skull size during Dr. Crossley's study. It is clearly shown that the wild chinchilla skull teeth were all shorter than the captive chinchillas. These results show that certain aspects of the captive breedings are responsible for the developing Chinchilla Dental Disease. It is suggested that the diet is the main cause. Providing a diet that closely matching the diet of the wild chinchilla should significantly reduce the incidence of the dental disease in the captive chinchillas. But please closely match the wild chinchilla diets refer to its physical form and composition, not telling you to feed natural form. Many folks got the idea that chinchilla eat fresh grass in the wild, so it's okay to feed our chins fresh grass. Some people believe that giving natural forage as a feed can reduce the dental problem. Such as this person here in the Instagram, Chin Lady believes that grass promotes healthy natural tooth wear plus mix herbs for the diet as a daily nutrition. That is entirely inaccurate. We must understand that the tooth crown and the skull are related to how they wear down the teeth. Let's take a look at what scientific study says. In Dr. Crossley's study, there's a specific sections about skull size and cheek toothing in wild caught and captive breed chinchillas. Study tell us the wild chinchilla's teeth are much shorter than the zoo or pet chinchillas. Also, the different style can change the patterns of tooth wear and impact the bite. Food shapes and physical property are significant for herbivores, affecting chewing and tooth wear patterns. This means the wild chinchilla eat those plants in their area that are much more rough and dirty. Less energy is provided. Therefore, there's need much more longer to chew. Not to mention the mineral inside those plants can help wear down the teeth faster. Compared to our past, chinchilla's food and hay are much more fiber and clean. Soft pellets are much easier to chew and high in energy, so they don't need much time to chew to get food. Required crashing rather than extensive chewing might be expected to affect jaw growth and development due to alterations in jaw muscle activity. Another thing about pellets is that they are contents with good nutrients, increasing the teeth wear resistant compared to the wild chinchilla which lacks nutrients and minerals. Sometimes when I hear stories about chinchillas not eating hay for 10 years but having no tooth problem, or someone fed her chins natural forage 10 plus years still no teeth problem, etc. But we don't know how these chinchillas scalp and teeth size. For example, in the trees episodes, that 23-year-old chinchillas have a very tiny short teeth. Some chinchillas have different scale size and tooth crowns, affecting their tooth growth and chew patterns like the wild chinchillas, which is allow them to wear down their teeth faster even don't eat much hay. But these are minority. Instead of believe some random Joes tell you how to feed your chins, just because wild chinchillas eat all kinds of things in the wild, we should listen to Dr. Crossley's scientific research. The study also talks about the UK feeding management and feeding practice back in the days, but I'm pretty sure that many worldwide chins owners are still using this kind of management. Imbalanced diet, fish sugary treats, and add fruit or veg for supplements, exposed to cats and dogs. And because of these inappropriate diets and environment cause the vast majority of the chinchilla to suffer from dental disease. And tooth elongations is one of the major dental problems for the past chinchillas. It is rare for the wild chinchillas mainly because of the difference in their diet. Dietary form and nutritional contents. It is suggested that we give our chinchillas low energy food to keep them busy grinding their teeth. This should help a high proportion to reach the 20 years lifespan. To be honest, I always thought that intestinal treat that everyone should know how to feed our furballs to keep their teeth healthy. Still, after my investigations, some people don't Google or YouTube, don't know the scientific facts, or don't believe in it, would still feed our little friend a lousy diet. Just like some old-fashioned people would tell you it's okay to feed rabbits carrots and veggies. But if you Google how to feed rabbits these days, tons of articles or videos say that only for treats but not the leading food for rabbits. The difference between rabbits, guinea pigs, and chinchillas is that in the first two having a large numbers of good knowledge pet owners know how to feed their pets. In contrast, chinchillas are uncommon pets. Instead of accepting scientific fact, they believe in experience and feed whatever's thrown their boat. That's what I said earlier. It's all about intentional and unintentional human factors. If you care for your chinchillas, you will do good research and keep a well-balanced diet for them. If you're first time watching these videos, you can check out episode 5 about chinchilla diet. Genetic factors. Compared to diet, constant monocultion for chinchilla genetic disorder is another significant human cause factor. The reason is evidence that many breeders are unwilling to call the line. Apart from closely study mentioned, another of my favorite article from Forever Fitness Chinchillas Rescue also point out that monocultion is a prime example of this due to bad breeding. I will put up a link below. Many breeders from the beginning get to know this disease would like to ask one question. Mono is recessive or dominant? Because if it's recessive, it will be easier to distinguish the line, make it more simple to breed healthy animal. Because if it's recessive, then it will take both parents to have this genetics issue to pass down these bad genes to the descendants. However, if it is dominant, then only need take one parent to pass this down to kid. Unfortunately, the answer to this question is a bit more complex than that. Some websites such as chinchilla.com referring this genetic disorder as a polygenic trait with multiple inherited factors. Let's start with the dominant inheritance issue. Interestingly, one dominant inherit issues need to go back to the scale studies. Compared to the wild chinchillas and zoo chinchillas and captive chinchilla scales, the scales of captive bred chinchillas were 60% longer and 6% wider on average. Their heights were also marginally greater than the wild ones. A small amount of healthy captive chinchillas is similar to the zoo chinchilla scale. Still, both of them are larger than the wild chinchilla scales. This is probably because the captive chinchillas get unrestricted food intake, reduce energy demand, and great essential nutrients allow maximum growth. Also, chinchilla were bred for fur and sole purpose back in the day. They were often selected to breed a head shape is more round and fat than those wild chinchillas' long and narrow head shape. So the head is bigger and heavier. Since our skull and mandible and teeth are functional as one unit, the teeth are likely to be longer in bigger skulls. These tooth growing too fast disorders were developed far back from the 70s. However, back in the days, those fur breedings would try to remove lousy genetics to breed. However, this dental disease is still continuously developing in the 20th century modern chinchillas. I believe every animal's body structure is designed differently for its life. Why the wolves huge wanderers who can walk 8 hours a day without feeling tired? Because their elbows and body were precisely balanced over the large feet are built for walking. Why do wild chinchillas barely have a dental problems? And why can some so-called crab-looking chinchillas live their lives for 20 years? When we humans change the interiors of the animals, we causing troubles for the head structure. Two crowns change, which is one of the issues for the tooth disorders. That is why genetic malocclusion is still one of the most significant issues for the captive breed chinchillas. But of course, some countries after 30 years of improvement have a short-nosed round head show quality healthy chinchillas. But do they live 20 years life? And take how many years of work and hard work to selecting the gene pools to having some healthy animals? We will talk about in the next episode. Next, we will take a look at the recessive inheritance issue. Overbite and underbite are recessive diseases that are more studied in rabbits than chinchillas due to different type of scales. Here's a photo from Crossley study that look like this. This recessive disease is rare in modern chinchillas compared to the roof allocations problems. If you watch until now and you think that we have learned the dominant and recessive disease and think that is about it, right? Nah, that's not enough. Earlier was mentioned about the polygenetic growth rate. Polygenetic referred to multiple genetic disorder disease. In 2011, News Channel did a presentation educating Norwegian breeders about chinchilla dental problems. I borrowed some of them to explain the polygenetic disease and show samples of how high a percentage of chinchillas will get disorder genetics if people breed these animals. Certain genetic disorders can trigger malocclusions. If there's only one disorder, it might not happen in the chinchilla's whole life. Or maybe it happens very late when they were old age where the bodies get weaker. But suppose all these disorders add up to crossbreeding. In that case, the more these disorders are inherited, the malocclusion can worsen and happen at an earlier age. For example, a chinchilla has a pelvic dysfunctions. If it is a good care in its whole life and never put in breeds, this animal may never happen malocclusions. However, if a chinchilla A is breeding with another chinchilla called B, who has a hormone disorders, so A and B chinchillas offspring will be inherited two disease already. And suppose this offspring is called C. C chinchilla breed with another chinchilla called D, born with a weak skeleton. In this case, their offspring could be inherited with 4 different genetic disorders. then these offsprings are likely to have a very early monoculture disease happen due to a super weak body system. Let's take a look at what percentage of a disorder's genes offsprings will be produced if people breed these animals with recessive and dominant inheritance disorders. That's why sometimes we heard stories about a chinchilla that was healthy but suddenly got mallow at old age, or some chinchillas who were under 2 years old got Monocultions like Banded Phoenix, Emily, and Ding. Ding and Banded Phoenix, Emily, these chinchillas can be sure that family lines are repeatedly having genetic disorders in inheritance. The more they inherit, the worse it gets, but of course, we cannot tell whether they were inherited dominant or a polygenetic disease. Still, they are in severe malocclusion at early age, and these animals should never be bred. Sadly, there's always some shit breeders greedy for monies and do not care about the animal's health. As we can see, the inheritance issue is not only recessive or dominant, but more polygenetic traits. And since we can't tell which genetic disease the chinchillas are prone to monocultions, the only way to prevent unhealthy genetic passing down to the descendants is to stop breeding these animals. The parents and the relative. It is a primary key to preventing some dental disease. But sometimes we also heard breeders talk about selective breeding. Still, it will pop up once in a while without any inheritance trait. Not just because some other factors can contribute to malocclusions, such as these. We call it secondary factors, but it should never happen if you take good care of your animals. You might ask, how to find out my genes is inheritance or secondary factors? Assuming you did your research and know how to feed your genes and have a well care for them, the diet factor shouldn't be an issue. So, if you're sure you have an excellent care diet and no injury to the jaw or mouth, you can consider a genetic issue. Most breeders agree that inherited issues are likely to occur in chinchillas below 3 years old. Some chins are as early as 9 months old for very skilled breeders to detect the jaw lines. And if the chins are after 3 to 5 years old, many will consider it as a secondary factors. But of course, the best is to ask your breeder to check if the chinchillas have any dental problem records in the family lines. Not just parents or grandparents, but also the relative. A responsible and honest breeders will have all the records for their lines. If you're suspecting your breeders is dishonest with you, then you can talk to and question other breeders. The chinchilla world is actually very tiny. Most of breeders exchanging or buying animal for breedings, so someone will know someone's animal for sure. The best way is to take your animals to do an X-rays when you found early symptoms at young age. The last is a sample tumor to the jaw or damaged teeth. Some photos shows how it looks. So there is no excuse for a breeder to tell you this reason for a dental problem if your chin has never been injured, because it is easy to determine if any injury caused the dental problem. It is recommended that jump boards are no more than 30 cm in between to prevent chinchilla fall damage and no cage biting. If you have been watching up until now, congratulations, you have learned a lot of popular knowledge about chinchilla's dental problem. I know you might think that chinchillas are so easy to get mallow due to the complexity or genetic issues, but please think about it. Chinchillas are an exotic animals and have only been popular as a pet for 30 years. They are pretty unique and need particular care when breeding these animals. We shouldn't really blame the animal with many dental disease when they live fine without many teeth problems in the wild. Instead, we should be more strict about who and how the people are breeding these animals. So that's all for today, and thank you all for watching. If you have been spent 30 minutes to learn about Chinchilla Dental Disease. Also, a big thanks for new channels for her help sharing all her knowledge and experience about the Chinchilla Dental Disease. The next episode will be the last part of the Chinchilla Dental Disease videos. We will talk about the atmospheres of many chinchillas breeding around the world. I call it a chinchilla utopia, and why I do not want to breed chinchillas anymore. So stay tuned, and I will see you guys next time. Bye!